We baby boomers have a host of great things to look forward to as we get older, but I think we can all agree that at the top of that list should be our own good health. Well, as we all know, the year 2014 means the Affordable Care Act, or Obamacare as it's often called, is in full force with new benefits, protections, and requirements. Despite its rough rollout, the ACA will greatly expand the health care benefits for millions of Americans with no health coverage, as well as millions who have had to struggle to buy their health care coverage on their own. But what does it mean for those of us who are already on Medicare or are nearing that magic age of 65? Well, joining us now to help us unravel all this confusion is Nicole Duritz, AARP's family and health expert. Welcome, Nicole.
Thank you so much for having me.
We have lots of questions. So for those of us who are baby boomers, and most of us probably are already members of AARP, so how is your organization helping us prepare for all these upcoming changes in the health benefits?
Well, as you mentioned, there's been a lot of news coverage and a lot of confusion about the Affordable Care Act and what it means. And so AARP has created tools and resources to help people understand what it means for you and for your family so that you can make informed and educated decisions.
Well, we've certainly seen a lot of media coverage, some of it not so favorable, but also some of it very uninformative and unhelpful. So could you help us understand what this will mean to different people?
Sure.
And how they could navigate, especially if they're on Medicare?
Well, so for Medicare, it's a great place to start. One of the big pieces of information that I'd love to get out there is that your guaranteed Medicare benefits, going to the doctor, going to the hospital, those are protected in this law. So you don't have to worry about that going away, whether or not you're 65 or 95, those benefits are there. There's also been some new benefits added. There's new preventive benefits. So if you go in and have a screening for cancer or a mammography or some immunizations, those are available to you for free, no out-of-pocket cost to you. And then I think finally the biggest news is the closing of the Medicare prescription drug donut hole or coverage gap. That is going to help tons of people and already has.
Well, that's one I hear a lot of people complain about over the years, ever since it got passed, is the problem with the donut hole, because you fall into that never land where you're paying full price. How does this help close that donut hole, and when does that end up closing?
Sure. So before the law was passed, you would spend a certain amount of money, and then you would fall into the dreaded donut hole, and you would be responsible for 100% of the cost of your medications. Well, now, with the donut hole closing, this year, you're saving over 50% on the cost of your brand name prescription drugs and over 20% of the cost of your generic medications. And then by the year 2020, the coverage gap goes away entirely, and you'll just be responsible for about 25% of the cost of your medications until you spend, well, this year it's close to $5,000. And then you're in the catastrophic benefit and you only have to pay 5%. That is saving people a lot of money today.
What about the baby boomers that are under 65? How does all of this affect us?
So the law helps people who are in that age bracket. So between 50 and 64, that's been one of the most vulnerable sections of our society when it comes to getting health coverage.
Oh, my friends, yeah. Everybody's scared to death.
Exactly, because over the course of your lifetime, you get some bumps and bruises. You might have higher cholesterol or blood pressure right now.
Torn meniscus.
Exactly, or knee injury. And what happens is those are pre-existing conditions that have kept many people out of being able to get health coverage, or that what they were going to charge you was so dramatic that you couldn't pay for it, or it didn't cover the illness that you were trying to protect yourself from. So under this law, under the Affordable Care Act, nobody can be turned away or denied coverage just because of a pre-existing medical condition. And that's huge.
That is huge. Well, how is AARP helping us with resources to sort of navigate this new marketplace? I understand you guys do have some resources in place.
We have a lot of resources. And one of our favorite pieces is our Health Law Answers tool. It's an online tool that's available at healthlawanswers.org. We've also built it in Spanish at mileidesalud.org. And what you do is you go on and you answer some simple questions: where you live, your age. And what happens is we create a customized report just for you based on the answers that you've given us that guides you through the next steps of your process. It works whether or not you're 26 and just starting out and looking for health insurance, maybe you've already got coverage, or you're shopping, or you could be on Medicare. It doesn't matter what your situation is. The tool will provide those answers for you to guide you through the process.
Oh, good. So it gives guidance to help you find out where you should go.
That's right.
Because I find so many people are very confused as to how any of this operates.
Exactly.
So I gather the enrollment is ongoing right now. How long do people have to sign up for the new healthcare coverage?
Sure. So open enrollment started on the 1st of October, and it runs all the way through March 31st, 2014. But it's important for folks to sign up soon, because if you sign up by December 23rd, your coverage can begin on January 1st. But even if you miss that deadline, it's not a big deal, because you have all the way through the end of March. And, you know, as we were chatting about before, the fact that there have been some hiccups in the website, but there's a lot of ways to sign up. You can go to the website at Healthcare.gov, or you can pick up the phone and call. And the number is 1-800-318-2596. You can also work with people in person, or you can download and fill out a paper form the old-fashioned way, put a stamp and put it in the mail. So there's lots of ways to sign up.
People forget about that these days, that you can actually do that.
Exactly.
But you have to download it first.
That's true, but there haven't been problems downloading the paper application, so that makes it easy.
Oh, good. Oh, good.
Yep.
People are happy to hear that there's something with no problems.
Exactly, exactly.
Thank you so much for coming by and helping out with this. Really appreciate it.
Thank you.
Thanks. For more information on AARP and how it can help you navigate Medicare and the new healthcare law, go to healthlawanswers.org or call 1-800-318-2596 to look at their options and enroll, or log on to babyboomersinamerica.com. Thanks. Thank you.